Acetaminophen, or paracetamol, the selective COX-3 inhibitor. What are the differences between acetaminophen and the non-selective COX inhibitor, acetyl salicylic acid, or aspirin? As regards the pharmacological actions, acetaminophen lacks the antithrombotic and the anti-inflammatory actions, and retains the analgesic and the antipyretic actions. As regards the indications, aspirin is usually preferred, except in these situations. 1. If you need an analgesic or antipyretic and there is hypersensitivity to aspirin, particularly aspirin-induced asthma. 2. If you need an analgesic or antipyretic in peptic ulcer patient. 3. If you need an analgesic or antipyretic in gout patients. 4. If you need an antipyretic in a feverish child, secondary to viral infection. And lastly, if you need an analgesic or antipyretic and there is a bleeding tendency. As regards the adverse effects, at therapeutic doses, acetaminophen is very safe drug, and usually induces no side effects. However, it may be toxic in two situations: committing suicide with a dose more than 15 grams, and this will be discussed in details in the next slide. Long-term use in combination with acetaminophen, and this is already discussed with renal adverse effects of aspirin. The hepatic toxicity is related to its method of metabolism. 95% of the ordinary dose of acetaminophen is oxidized into a non-toxic metabolite. The remaining 5% of the dose is conjugated into a toxic metabolite. However, the amount of this metabolite is small, and it is easily detoxicated with glutathione. If the dose of acetaminophen exceeds 15 grams, the percentage metabolized by oxidation will be small, compared to that metabolized by conjugation. And the amount of the toxic metabolite will be huge. Glutathione reserve of the body will be depleted. This metabolite will induce fulminant hepatic failure. The manifestations start by vomiting in the first 24 hours, though the patient may be asymptomatic. After 72 hours, hepatic necrosis occurs, manifested by jaundice and coma. The condition must be treated as early as possible, with SH-containing compounds, such as acetylcysteine.